Hi, I'm going to be simulating an epidural catheter insertion. Before beginning, I'm going to review the patient's chart to look at their INR, their platelet count, their anticoagulation status to ensure that there are no contraindications for this procedure. I'm also going to look at their allergies, and before beginning, preload the patient with 500 to 1 liter of crystalloid fluids. I will also confirm allergies. When in the room, I will make sure the patient is hooked up to all standard monitors, including their blood pressure, the EKG, and a pulse ox. And I will make sure those alarms are on and audible. To position the patient, I will have them seat at the edge of the bed with their feet dangling and arch their back in the shape of a letter C. I will palpate the superior iliac crest with my fingers and with my thumbs in their midline, make an indentation with my fingernail, and that will signal to me that that is the interspace of L3, L4, or L4, L5. After that, I'm going to don my hairnet and mask. And I'm going to wash my hands. I'm going to open up my sterile tray. And apply the cleaning solution over these swabs and clean the patient's back. Now I'm going to apply my sterile gloves. And I'm going to assemble the rest of my epidural kit. I'm going to verify that I have lidocaine 1.5% with epi 1 to 200,000. And I have lidocaine 1% and then normal saline. In a 3 cc syringe, I will draw up lidocaine 1% with the help of an assistant to make sure I don't contaminate the ampules. And I will draw up in a 5 cc syringe lidocaine with the epinephrine test dose in it. And in my 20 ml syringe, I will draw up bupivacaine 0.25%. And I will use the filter to draw up these medications from the ampules. After that, I will place the drape on the patient. And reconfirm my interspace and position in the patient's position. With my lidocaine syringe, I'm going to lidocaine 1%, create a skin wheel, and I'm going to inject the needle 15 degrees cephalad, angled up and towards the umbilicus. And I will inject to the lidocaine. Now I'm going to insert the epidural needle with the stylet, with the bevel facing up, through the skin, subcu tissue, the interspinous ligament, and once I feel that crunchy feeling, I know my epidural needle is seated correctly in the interspinous ligament. Then I will remove the stylet and attach my glass syringe that has 2 to 3 mils of saline or air to the needle. Now, as I am holding the needle with my non-dominant hand, I will advance the needle slowly while pushing on the plunger with my dominant hand. As I'm advancing, I will advance until I feel the loss of resistance and the needle and the plunger go all the way in. At this, I will note the depth of the needle, 5 centimeters. I'm going to detach the syringe and thread my epidural catheter in. I'm going to thread the epidural catheter in 4 to 5 centimeters past the mark of where I left, of where I noted the loss of resistance on the needle. We're going to say this is about 10 centimeters. While still holding on to the catheter, I'm going to withdraw the needle. To not contaminate the epidural catheter, I'm going to slowly withdraw the needle and loop the catheter in my non-dominant hand. Make sure it stays on the sterile field. Now I'm going to attach the adapter to the end of the catheter. I'm going to attach my filter to the end of the catheter, into the end of the adapter, while still making sure the catheter does not move. I am now going to attach my 5 cc syringe with my lidocaine and epinephrine test dose and do a aspiration, making sure that I am negative aspiration for blood or CSF. After administration, after negative aspiration, I'm going to administer 3 mils of 1.5% lidocaine and 1 to 200,000 of epinephrine. Test those through this filter. After that, I will wait 3 minutes to confirm that it is negative for intravascular or intrathecal injection. If it would be positive for intrathecal injection, the patient would immediately feel motor or sensory blockade. Or intravascular injection, we would see increased heart rate or blood pressure on our EKG and blood pressure cuff. After that, I'm going to attach my 20 cc syringe of bupivacaine 0.25% and aspirate. If it is still negative for blood and CSF, I'm going to inject the bupivacaine in 5 ml increments, making sure to aspirate in between each 5 ml injection. Aspirating and injecting the last 5 mils. When that's done, I will apply a dressing to the epidural catheter. Allow the catheter to sit, and then secure it down to the patient after removing this. And to secure it to the patient, following the natural curvature of the catheter. If it was warranted, I could connect this filter to the PCA pump. When all is done, I will assess the patient, the vital signs, and the block level, and make sure that this is all documented in the patient's chart.